The Raw Truth with your host, Christina Rivera. In this Savvy Broadcasting series, we delve into hot topics affecting us all. With cancel culture and big tech censoring any opposing ideas and thoughts outside of mainstream ideology, it has become more important than ever that we tell the raw truth about everything from U.S. world politics, COVID, Christianity, and everything in between. We invite all points of view to come and share their perspective honestly and respectfully. Hello, Dr. Elliot Justin. Welcome to Savvy Broadcasting's newest series, Forbidden Speech. We're so grateful to have you here today. How are you?
Very good. Thank you. Good to be here.
You betcha. You've worked as an emergency medicine specialist as well as being a specialist in heart and diabetes. But, we're going to talk about something very interesting we've never hit on any of our Savvy series, and that is the significance of penis health. That it is really the kind of canary in the coal mine, as it were, for men's health. And when it starts not to work so well, it can be an indication of greater problems in your body. And so we're grateful to have you here talking about that today.
It's good to be here. Yes, when the canary stops singing, there's a problem. So you want to keep the singing going for as long as possible.
Absolutely. Now, why is it so intricately connected? Like, now I've heard that one thing in the body can affect to another, but how does the health of your penis kind of connect to other parts of your health?
Well, the same diseases that are the leading causes of death in the United States, vascular disease, heart disease, diabetes, hypertension, also affect the penis, and they affect the penis earlier. So everyone's probably heard familiar with words atherosclerosis or arteriosclerosis, hardening the arteries, or the arterial, the small arteries. Well, I'll just take hypertension for example. If the blood pressure goes from 130 to 140 systolic, what does that mean in terms of the status of your heart? If a hemoglobin A1C, which is the blood test that they use to monitor diabetes, goes up from, say, 6 to 7, what does that mean in terms of your diabetes? Whereas if you can't have an erection, it's highly likely that you have a significant vascular problem. So, ED is the warning sign, neglected warning sign of vascular health. Doctors never ask about it. And unfortunately, when men have ED, instead of discussing with their doctors, they go online and they order medications instead of asking the question and getting screened for heart disease. So this is an enormous problem. A million men in the United States per year, a million people in the United States per year have heart attacks.
Wow.
60% of the men who have heart attacks, in some studies, it's actually 70 or 80%, have ED. If they identify themselves as having ED earlier and sought treatment, that might be prevented. There are 800,000 strokes per year. It's estimated that 80% of the men who have strokes have ED and did not get it. The majority of them did not get investigated. Diabetes, we talk about COVID as being an epidemic. Wow. Diabetes affects 35 million Americans. There are 8 million of them, of those 35 million, aren't even seeking treatment. They're undiagnosed. And there must be 80 to 90 million Americans who are pre-diabetic.
Wow.
So these people often have ED, and if they would acknowledge it and get screened, it'd be helpful. It's also important on the other side for the physicians to ask the question.
So is this ED would be erectile dysfunction, correct?
That's correct.
Yeah. So what I'm guessing, and tell me if you've come across this, are men kind of embarrassed? That's why they go and just maybe order the blue pill online. I'll just get my puppy up and working with these little magic blue pills without realizing it could affect their heart in a negative manner.
Well, half the time they don't even work. And men who have diabetes or hypertension, women have this notion, especially, hey, men, you take this pill, you get an erection. Well, doesn't work that way. So the pills what's interesting with the pills is that most of them are being taken for recreational purposes and being taken by young men who've gone online and talked to their friends, and they've heard that, gee, I can now treat whiskey dick with a pill. So a third to a half of men who have ED don't benefit from the pills because their diabetes or hypertension have already reached the point where the blood circulation in their penis is affected. But it's not just the patient's fault or the consumers. It's the doctor's fault. Look, I ran emergency departments. I practiced emergency medicine for decades.
Wow.
Physicians are trained in medical school to take a sexual history. We don't. I mean, I as a patient, I've never had a doctor ask me my sexual history ever, and that's normal. I don't,
Why? Why is that? Because when I've gone to the hospital or the doctor, I get asked a million questions. But you're right; they don't really ask anything about my sex or my sexual activity, other than are you think you're pregnant or not?
Well,
yeah,
right. So I think the embarrassment is mutual, and I think it's a problem. So in my last year of medical practice, being interested in this point, I started asking the question. And if the man didn't want to ask the question, his wife did. So it was so you could have someone come in with an ankle fracture or a pneumonia, whatever. If you ask the question and you ask it nicely, not in a confrontational way, it's not like saying, "Hey, do you own guns at home?" and you keep them locked up. It's you ask the question politely. People want to talk about it because this is an issue of enormous importance, especially people as they get older. I mean, the incidence of erectile dysfunction goes up 10% per decade after the age 35 or 40. I'm 68. By my age, 60 to 70% of men have ED. Now, more than half of that is physiological. There are other causes of ED, alcohol, recreational drugs, things of that nature. And also there are medications that can cause ED. Now, there's another important reason for doctors and patients to think about the question and ask the question, because it could well be that your ED, which is having an enormous impact on your relationships and other aspects of your life, could be due to the medications that you're taking.
Well, you might need them, but they might have to come up with a plan of action that you continue to stay on your medication, but somehow able to increase. Now, what happens if your health is having problems? How do you know, well, how do you begin to fix it so that you can begin to have a wonderful sex life and you don't have that issue?
Well, you're getting at something really important, which, I mean, people need to ask the question. And they also need to recognize, one thing that should spur them to ask the question are the enormous benefits of sex. I mean, if you're a man and you're having 20 orgasms a month, your risk of prostate cancer goes down by a third. That's in young men. So you might early practice, so to speak, yields benefits later on. In significant large studies in Wales and in Sweden, men who are over the age of 60 and were having sex more than twice a week, their risk of overall mortality went down by 50%. So the benefits are enormous. One of the problems is we don't, aside from asking the question, we don't really have the tools yet to make it easy to measure what I call erectile fitness. So before there's erectile dysfunction, there's fitness, and in between things start to deteriorate. So how do you maintain fitness? And most importantly, how do you monitor that? So, if a man goes to a cardiologist, or a woman for that matter, if a man goes to a cardiologist, or a woman goes to a cardiologist, or man goes to a urologist, or a woman goes to a gynecologist and complains about sexual dysfunction, they don't have the type of tools that we have working in the ER or working in the cardiologist's office, where you have ultrasound, EKG, blood pressure, pulse oximetry, tools that can make diagnosis and treatment objective. All you really have is opinion. This antidepressant is better than that antidepressant. This blood pressure medication is better than that blood pressure medication. But the pharma companies, they never go head to head with these drugs. So it'd be great to have tools. So one thing that's coming in 2020, I'm working on, I know there are other people working on it too, and it's going to revolutionize this area of healthcare, is the ability to monitor something that's called nocturnal erections. So a young man will have 4 to 6 nocturnal erections per night, and that's during your REM sleep. A man like my age will have 3 to 4 nocturnal erections per night. If that number goes down, so let's suppose I'm having 3 to 4 per night, and I went to 1, I'd still be able to have sex every day if I wanted to, but I would actually be on the verge of a cardiovascular disaster, a heart attack, stroke, some significant problem with diabetes or hypertension, but I wouldn't know it unless I had the ability to measure it.
Yeah.
Now, on the female side, if you don't mind me going in that direction, moving
Go
away
for
from erectile dysfunction, because women have erections too, they're just less aware of them because they're less.
They're inside. You
They're
don't
inside.
see them.
They're less obvious.
Yeah.
No one now. There are about 15 papers indicating that nocturnal erections are predictive of vascular health in men. So if a man goes from potent to impotent, they have a 20 to 40% risk of having a cardiovascular event in 1 year. What about women? No one has studied it since 1983. I mean, it's really extraordinary. So one thing that's going to happen in 22 is that tools are going to become available to doctors and to men and women that will allow them to monitor this activity, this silent activity of nocturnal erections. I mean, men are kind of aware of the one they have when they wake up, but they're not aware of the ones that they have when they're sleeping. Although I will share with you that, doing research in this area and working in this area, to use a non-scientific word, I'm more conscious of mine. Actually, so I assume they're sort of on my mind, and I wake up to that. I would never. I mean, I don't think I've gotten 4 times as healthy as I did, a year ago. It's just more in my mind.
Yeah.
And it's actually because it's on my mind. My wife is actually starting to say, "Well, wait a second, something happened." It's 2:00 in the morning. I'm kind of, I'm sort of aroused. So to make these tools available to people is going to give people a new vital sign for what's their men and women's most vital organ. I mean, I don't have a fancy watch with apps on, but lots of people, you and I both know people who have
the Apple, Fitbit, all of that.
Those things. Well, now we're talking about about smart underwearables for everyone's favorite vital sign. I mean, what does your average man care about more? Whether he took 10,000 steps yesterday, or whether
how's my penis doing?
Right. And the same thing applies to women as well too. So.
Yeah. And you know what? This is great because if you build these these tools to check your vitals, people will be able to check for themselves and say, okay, things are not going well. What can I do to stop the reduction of my health and get myself more healthy? I mean, yeah, you might be able to know that, hey, I'm a little overweight or this or that, but you won't know if you're heading for a heart attack or if I won't be able to get it up or feel sexually, charged. But that's only the tip of the iceberg. How about all the other stuff you could be having going on? So this is just great that you're building these tools.
Especially medications. I mean, so many men and women are taking antidepressants, mood altering drugs, as well as antihypertensive medications that have an impact on their sexual performance. And with these tools, in addition to monitoring their overall vascular health, and probably more accurately than just checking your blood pressure or checking your hemoglobin A1C a couple times a year if you're diabetic, they'll actually be able to, in the privacy of their home, be able to establish baselines and monitor the impact of medications and other things upon their erectile function, and hopefully maintain their erectile fitness before they become erectile dysfunct.
Yeah. So let's say when the tools come out, they'll be able to take these readings. I don't know what's it going to look like. Is it something you'll plug into your underwear, or
we have at FirmTech, we have our approach. I know there are other companies that have a different approach, but for men it'll be a ring with a sensor that can monitor. It'll be worn over, comfortable ring to be worn overnight, and would monitor the number and strength of nocturnal erections. For women, it would be a form that needs to be obviously hard to hold in place. There's nothing to put a ring around. So how's it going to be held in place? And I've had some interesting conversations with women about, because there's the panty group and the thong group, and those who don't sleep with anything. Well, those who don't sleep with anything have to sleep with something now if they want to measure their nocturnal erections. But I think for women,
I wonder if you could do something like a tampon and put that ring on the tampon and then stuff it up there or something.
That's been
an idea.
Yeah, it's a good idea because but I think there, with women, actually issues of fashion looks, enter into it. Whereas with men, it's simpler. It's a ring with a sensor.
Yeah, absolutely. So they get these details, then they can bring them to their doctor and discuss what they can do to help wherever their issue is.
Yeah, previously for men, there was just a device called the Rigiscan that looked like something like Dr. Frankenstein would put on you, and you had to go to a sleep clinic and wear it overnight. But my company and other companies are working on things that are much more consumer friendly.
Awesome. And when is it ready? What is the time schedule?
We hope to launch male and female products in the first and second quarter of 22.
Awesome. I know everyone's gonna be excited to hear that. And yeah. So do you have any suggestions for couples out there wanting to increase their sexual,
I do, actually. I think that people need to plan for pleasure. I think that people, I'll just give if having sex twice a week is associated in men with a decreased mortality risk by 50%, but yet your average man over the age of 60 in the United States having sex 20 times a year, that's a lot of catch up. So I don't know why, but people seem to find it easier to get on a Peloton or go to Pilates class than they do to make love more. So it's always kind of mystified me. If your marriage sucks or your relationship is poor, and often sex is either a reflection or the cause of the problem, and you're exercising 14 hours a week, why can't you take 4 hours that week away from your exercise and dedicate it to improving the intimacy in your relationship? I think people need to plan for pleasure.
That's a good point.
If they plan for pleasure, they'll soon find that they enjoy it, or else they might find they're with the wrong person. But in general, they're going to find they enjoy it. I think people get out of the habit. I see this so often, whether it's work, it's kids, but people fall into this habit. And once you sort of move away from regular sex, it becomes a source of awkwardness in a relationship and a challenge, as opposed to a source of pleasure and security.
That's awesome. Yeah. And so I'm glad for that. Now, how can people get a hold of you, find out more about your upcoming technology and get a hold of it when it's ready?
Sure. Well, right now we have a landing page as a website. The full website will be up in September, but they can go to the website and contact us through the website.
And that would be the one listed below, myfirmtech.com.
Correct.
Awesome.
And we will become active in December.
Oh, yay. Just in time for Christmas.
Correct. And certainly on time for Valentine's Day.
Yay. Well, I just have to thank you again, Dr. Justin, for coming to share this great wisdom today on Forbidden Speech, the raw truth. Thank you.
It's a pleasure. Plan for pleasure.
That's right. Like, subscribe, and share this episode. To listen to more Forbidden Speech or Savvy episodes, visit savvybroadcasting.com. To find out about our paid sponsorship opportunities or how to become a guest, email Christina at lifeunscriptedradio.com.